Okay, so this is a GH dislocation wrap. We're going to use 4-inch double once again, as opposed to 6-inch double, which is used for more lower extremity injuries. And with this wrap job, you want to make sure it's very similar to AC wrap, where you're going around the shoulder, but we're Xing over the GH joint, and we're also preventing abduction external rotation, which is the most common mechanism for shoulder subluxations and dislocations. So when we put them in position, we're going to internally rotate the shoulder, and I'm going to pull posterior to anterior across the GH joint. Once again, preventing loss of circulation. You want to make sure they contract their bicep. When I set my first anchor, I'll make sure this is not too tight, but then when I pull across the anterior side of the shoulder, I'm pulling nice and tight. So we'll tie it across there and X back over the GH joint. Continue the wrap around the front of the chest and over the back, crossing over the GH joint until the entire wrap is used. Make sure it's nice and tight across the anterior side of the chest. And at this point, I can't get that back around, so I'm going to go ahead and put that on his arm and then anchor with some shear light. It's nice stretchy tape. Follow along the same pattern I just did. And then you always want to finish with some Zonus or Coach tape just to make sure that the shear light does not come off. So make sure you don't get this too tight. Have it make a muscle. And that's a GH joint wrap, which should prevent abduction external rotation.